Welcome back to episode 66 of Your Birth Bestie podcast. Today I wanted to talk about the process of preparing for my own home birth any day now, and how it's really not that much different than how I would prepare for another hospital birth. And I'm not going to compare it to how I previously prepared for my other two hospital births because I didn't know then what I do now. But I do want to give you some insight on how I'm preparing for my birth and how you can plan for a home-like birth in the hospital setting if you are not wanting to deliver at home. There are many women in this situation where the intimacy, the atmosphere, and autonomy of a home birth is very desirable, but it's just not the right fit for them, and that is completely okay too. So keep listening to hear more about how I'm planning for my third birth at home and how it can help you love your birth experience too, no matter where you're birthing your baby. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. So as of yesterday, I am officially 38 weeks pregnant and have been doing several things to support my body in preparation for my upcoming birth any day now, which include walking every single night, stretching, using a mindset app called Insight Timer for meditation, eating dates and pineapple, drinking my red raspberry leaf tea, hand expressing colostrum. And then the other things I like to do are, things like distracting myself by staying busy with my other kids throughout the day, and honestly just waiting as patiently as possible with the support of my birth team because it is so challenging, but leaning on other people for support and encouragement during these last, days or weeks or maybe even a month is so important. This time, I do not want to rush anything at all. I don't want any cervical checks in pregnancy. I don't want to talk about induction at a certain point due to my history of having big babies, because it is as much, if not more, in my opinion, of a mind game than it is that physical endurance in the home stretch of pregnancy. I have been down this road twice before, and I also help other moms all the time being in this work, so I have a good idea of what to expect and how to cope, and that has been really helpful. But of course, it's still not easy, and I thought it might be a little bit easier this time, but it's definitely not. It's just as challenging and just as excited and anticipating, bringing my daughter into this world that I just really can't wait to meet her and kind of just want to continue life with having 3 kids, and anticipating what that's going to be like is a little bit scary. So, I'm definitely ready, and the wait is definitely difficult. But you might not be this far along in your pregnancy like I am right now. So I do want to take it back a little bit, actually a lot of the way back, because these are some important things that I want to be sure to address as well. And the very first thing is choosing a provider that you trust and that will support you, your wishes and your values. The common things that moms want in their birth setting that are more prioritized, I would say, in a home birth setting than in a hospital setting are things like physiologic birth, support to have your baby unmedicated, having an undisturbed experience or an unrushed birth, low intervention, and really that intimate, personalized environment. Obviously, hospital birth allows for immediate access to medical intervention and emergency care, which can be reassuring if you are concerned about possible complications, but also having enough knowledge about birth and having an idea of when interventions may be recommended and the boundaries that you are okay with to help you navigate decisions in that moment are really important. Home birth midwives, though, are also trained in those medical emergency situations and are able to assess and manage at home these certain kinds of emergencies with different techniques and medications before potentially having to transfer. So the difference here is that the providers in the hospital system are trained within the medical model and see high-risk patients and more critical situations more often. So I really feel that that bias sometimes can cause them to jump right into treatment in a more conservative way because it is standard and because, of course, it's available in the hospital. So something to consider with each setting, but also knowing who you are hiring as your provider is important and feeling confident in how they will support you. So that is something that I've already planned for in my home birth, and I love my midwife and I trust her, and is something that you should also take very seriously too. Preparing a birth plan or a list of preferences is really important too, whether you're giving birth at home or at the hospital or a birth center. I explain a birth plan to families as more of an exercise than a plan because you can't plan for birth exactly, but that doesn't mean that there aren't things to consider ahead of time, and it can be very beneficial to know your preferences ahead of time and already have thought through that process. If you're planning a home birth like me, I also have a transfer plan and a hospital birth plan where I've thought through every scenario and what I would be comfortable accepting regarding medical care in those situations. This is where you as a patient can really be an active participant in your care, which is more accepted or I guess integrated into the midwifery care model in the home setting, but that doesn't mean in the hospital setting that it's not possible. Hospital prenatal appointments in the clinic are typically very, very short. They are not all that personal if you are maybe seeing a new provider each time, or you might even feel dismissed by certain providers. There are some red flags to consider, another provider or switching practices, but if you don't have that option, voicing your concerns and covering all the bases of your birth plan and verifying that they will be able to comply with those requests is important throughout the span of your entire pregnancy before you go into labor. You want to go into birth feeling confident and in control and not nervous or afraid of, maybe what is just going to happen to you because you feel like you don't have control. You can definitely be in charge, and this is really the key to a positive birth experience. The next piece of planning and preparing for a positive birth experience are going to your regular prenatal visits, no matter where you're having your baby, because it's a big part of preparing for birth with your midwife or your doctor. You want to monitor your health and how well baby is doing too, and it's important to identify potential issues that might impact your birth plan. It's also an opportunity to get to know your provider and feel comfortable with them during labor and delivery. So if you are part of a practice where there are several midwives or several doctors, trying to see as many as possible so that when you do show up in labor, whoever is on call, you've already met with once before and they kind of have an idea of what you are expecting in terms of care for your birth. This time around, I did not have as many prenatal visits as I did with my other two babies. The schedule, if you're familiar with prenatal visits, is typically every 4 weeks until you're 28 weeks, and then every 2 weeks until you're 36 weeks, and then every week until you have a baby. It was my personal choice to skip several appointments this time around, but I definitely made sure to get my labs drawn early on in pregnancy, an early ultrasound for dating, an anatomy ultrasound at 20 weeks, the gestational diabetes at 26-ish weeks, as well as a lab draw for anemia. And then I only saw my midwife once after that appointment at 37 weeks, and now I will continue seeing her weekly until I have my baby. But I felt like the flexibility of the schedule of prenatal care was helpful for me personally. I took it upon myself to monitor my blood pressure, and I would reach out if I had any concerns about fetal movement or any other symptoms. I would always be in communication with her if something came up. So for me, I felt more confident and in control of my care because of this. Now, I am not saying at all to neglect prenatal care, but I also feel like women should know the purpose for each visit if they are low or high risk and what to expect before going into their doctor's office. For example, the 16 and 32-week appointments, especially for low-risk women, are used to take vitals and probably just listen to baby's heart tones. I remember being irritated with how long I would wait for these appointments and the long commute that I had with my other two babies, that it just didn't feel worth it to me, honestly. Again, in my situation, I was comfortable with foregoing many of these appointments, but everybody is, of course, completely different. My bottom line, though, is regardless of where you are getting your care from, you should feel informed and part of your care the entire time, not just checking off a list of routine appointments and tests because this is what's standard in the setting that you're in. Ask questions and feel confident. This is one of my favorite parts too of being a birth doula for families right now, is helping them have the education before and after their prenatal visits to go over and feel confident going into their appointment and asking questions. And also feel good leaving or asking follow-up questions to their provider for reassurance or clarification. Being involved and engaged in your care is so important. So I definitely encourage you to do so. The next thing is planning for your birth support team. I have a great team that includes my husband, my mom to help with the girls at home or take them to her house depending on the situation at the time of delivery, my primary midwife who will call in a second midwife for delivery, and then there will also be a student midwife there as well, and I hired a birth photographer who will be there too. People have asked me why I don't have a doula myself when I talk about how much I love being a doula and how helpful it can be for families, but it really comes down to your individual comfortability and the plan. I am comfortable with the education, making a birth plan, and pregnancy or, the birth prep aspects that the doulas provide, that it really comes down to labor support. And having 2 unmedicated hospital births previously, I am anticipating, or I feel like I know myself enough now that I am not one that wants to be, engaged in labor or touched. I prefer just my husband and I to be together and then to have support at the time of delivery or if a medical situation were to come up. And of course, this is what my midwifery team is for, and I trust them to help me manage my labor and birth safely. It's just not something that I feel an extra person in my very small home would be beneficial for me at this point. And typically, home birth is an intimate setting with less people, a midwife, doula, partner, and then friends or family if you invite them into your space. Hospital birth usually includes a medical team of doctors, nurses, maybe a doula, potentially additional support people, depending on the hospital's policies. But one thing to keep in mind here as you are planning your support team is that you are the one that is hiring these people to take care of you. It is okay to uninvite someone from your birth space or to limit the number of people around you while you're giving birth or even in that immediate postpartum period. Especially in the hospital setting, this is important for having a home-like atmosphere. You want to feel safe and comfortable, and when 3 doctors and their students walk into your room, or the entire NICU team that isn't necessarily needed, they are just there at the time of delivery just in case, or even extra nurses or their students, and then you have yourself and your partner, a doula, like all of these people can add up to be so many. And each person kind of comes with their own role, their own noise and chaos. So it's sometimes in your best interest to limit this and kind of ask ahead of time who is all expected to be there and make those boundaries ahead of time. I have experienced this with my first birth with way too many people in my room who had, I had no idea who anybody was, why they were there. Everybody was so loud. All the lights on, were on in the room. And I was just very confused. I feel like it was very violating looking back and not being informed or asked about any of these people, and having, 20, 25 people being in the delivery room within the first 5 minutes that she was born when it wasn't necessary. So that's a little bit frustrating looking back. So definitely a top priority that I would change if I could go back. And I do tell my hospital birth story with my first baby way back in this podcast in episode 2. So if you are interested in learning more about that experience, take a listen to episode 2. And then also my more positive, redemptive hospital water birth experience is in episode 4. But really what you want is somewhere to feel safe and an environment that you will be able to allow your natural hormones to flow and help labor progress rather than be in that fight or flight feeling, which leads to talking about the vibe of everything around you. And at home, it is by default the place that you are hopefully the most comfortable. It's a familiar setting where you can control the temperature, the lighting, and use whatever personal items that you may have, like music or aromatherapy. But then again, you can actually do all of these things in your hospital room as well, which is a focus of that first prenatal visit that I have with all of my clients. I want to know exactly what makes moms feel comfortable and calm, what reduces anxiety and fears, what kind of atmosphere they envision themselves welcoming their baby into. And being at home this time, I really don't have to plan much for these things because I am already at home. I have everything out and organized in the corner of my bedroom on a bookshelf for easy access, and then a list of what I want during my birth. And, I talked to my husband through where everything is and when things would potentially be needed. So hopefully that all goes smoothly and everything is kind of in one spot and easy to access. You can still bring personal items with you if you are in the hospital, such as pillows, blankets, essential oils, LED candles or string lights, an eye mask if you want to keep things dark, a comfy robe or slippers, a music playlist, pictures of your other kids or pets or family, literally whatever it is that makes the hospital room feel less sterile and more like a cozy birthing suite, the more you will be able to relax. It also helps to have the support of familiar people like your partner or your doula or a trusted family member or friend with you. It's important to remember you may love your provider, but you won't know who your labor and delivery nurse is necessarily. And your provider, unless there's a different circumstance, might not be the one that is on call for you the day that you come in labor. But your doula and your support team will always be there for you to make sure everything goes as smoothly as possible. Pain management is the next piece where preparation might be different in that the options available at the hospital are different than what's at home, but the mindset and the coping techniques are identical. Home birth typically involves natural pain management such as breathing exercises, hydrotherapy, massage, positive talk or affirmations, position changes, a TENS unit, ice and heat packs, a birth comb to squeeze during contractions, visualization, acupressure, and definitely many more. All of these things can be utilized in the hospital though as well. You have so many tools available to you at the hospital, and an unmedicated hospital birth is absolutely possible if that's what you want. There is the temptation of pain relief options though, such as IV pain medication and the epidural, but that doesn't mean that you have to consider them if maybe you don't want to. If you're planning and hoping for an unmedicated birth in the hospital, plan as if the epidural isn't even an option. Come up with your why behind not wanting the epidural and, having an unmedicated birth, why that's important to you. People ask me how I got through my first 2 unmedicated hospital births, and it was honestly due to the fact that I knew I didn't want one. And even though my why wasn't really strong at the time, I hadn't thought much about it, I just never really entertained the idea of wanting an epidural. So many moms say that I will try to go as long as I can, or I am open to an epidural if I need one, or I'm not really sure what I want to do yet, so I'll just decide in the moment. And the truth about labor, though, is that it is uncomfortable and painful, no matter what people that have a quote unquote pain-free birth experience will tell you. That is great for them and their perception, but to me, I've never experienced it or seen it happen, and I just can't see how you can go through a completely pain-free birth. There is such things as mindset shifting and treating the pain as power and reframing contractions as surges and energy. But to me, it is really, really hard and it's painful, but it is temporary and your body is made to do this and you are stronger than you probably think. Your mind will give up before your body does. So having that mindset that you don't want pain medication, if that's the case, of course, and creating reasons as to why would be my biggest tip. I'm not saying I only support unmedicated birth. I am just saying that this is what I would personally prefer for myself, and I love helping moms have unmedicated births if that's what they want, even though it is very, very difficult. I also love helping moms decide what pain management plan is best for them and supporting them in that decision so they can have the best birth experience possible. Some people are very fearful of labor pain and about birth in general, and they don't want to experience the discomfort. So for them, creating a pain management plan looks very different than somebody who is planning an unmedicated birth, and that is perfectly okay. Regardless of the plan, though, I do want to mention what I found helpful myself and something that I encourage all clients to practice in the unfortunate situation where an epidural doesn't work or maybe baby comes too quickly for there to even be time for that option. Meditation and breathing exercises to practice calming the body down in times of stress is what I think is the number one most important thing. Encouraging partners to know how to support mom with releasing tension and surrendering to the contractions, and also having enough knowledge of what's going to happen during labor and delivery to feel confident in the process and that what you're doing and what you're feeling in your body is normal. In situations like birth, where you may feel the contractions are bigger than you or that you're out of control, preparing moms for these strong feelings and moments where it does feel like too much, but then giving them the tools to cope through these situations. The hospital, in my experience, is less supportive of unmedicated physiologic birth, usually because about 80% of moms do get epidurals during labor. So being mindful of this in the hospital setting is important. In the hospital, requesting a nurse that enjoys supporting unmedicated birth is a good place to start as well upon admission if somebody is available. Also knowing, though, that there is work that needs to be done ahead of time to feel comfortable with this choice as well is important. And then lastly, what I noticed recently as I've really been preparing final details for my home birth that I didn't really have to think about with my other two labors is preparing the birth space, all of the supplies, and also just in general, the cleanliness of my home. I want everything to feel organized and ready for when baby is here, for the process to really go as smoothly as possible. The hospital obviously has employees that know where everything is. It's all systemized for each delivery, and in that way, things go very smoothly. I have spent a lot of time this last week preparing my space, making a list of things that needs to be done as soon as I think I'm in labor, and that has actually brought me a lot of relief with having this increased responsibility instead of just leaving my home and leaving it up to whoever's at the hospital. For example, I have a list of supplies that my midwife gave me, and I confirmed that is all purchased and organized in my bedroom. I also have a note card for my husband to follow regarding who to notify with their contact information, when they should be notified, and what needs to be done at home. The biggest priorities are filling up the birth tub, making sure my kids are taken care of, and notifying my birth team with the situation and creating a potential plan moving forward. My last labor was less than an hour in total, so who knows what will happen this time around, but I am all about planning and efficiency to make sure that we can minimize the chance of delivering unassisted, which wouldn't be the worst thing in the world, but I also prefer to have someone else there managing things because I have never had a home birth before, and my husband is a physical therapist, not a midwife, so that freaks him out a little bit too, of course, with how fast things went before and how I'll be at home this time. But if you are planning a hospital birth, having your bags packed and then also having a list of what to grab on your way to the hospital could be really helpful. Basically, a step-by-step in-the-moment list of priorities for yourself or your partner to follow. In a rushed situation or highly anticipated moment of leaving the hospital after months and months of waiting, it is easy to feel flustered and potentially forget something, but hopefully having a list to follow that is already prepped will help. I also said that was going to be the last piece that I mentioned, but other things that I'm thinking about that I am doing this time around that have been helpful for my own preparation and could hopefully help you no matter where you are giving birth are connecting with care providers like chiropractors, pelvic floor physical therapists, a massage therapist, and a lactation consultant. Body work with my massage therapist has been really a godsend in this third trimester, and I have been feeling really, really good, which was not the case around 34 weeks, and I thought I was going to have a long home stretch of this pregnancy, but I am actually feeling great with the help of my chiropractor and physical therapy and massage therapy. I also met with a lactation consultant at 34 weeks to establish care and come up with a plan for feeding, since my first two journeys were very different and very difficult. And I definitely want this experience with having two kids already to go hopefully much more smoothly. But having these people already established and caring for you can make that postpartum transition so much easier, and is something that I am looking forward to with this third labor and delivery. Just prioritizing self-care is something that I am not good at, but with this third baby, I need it more than ever to recover for myself and also be the best mom and partner to my husband as well. I feel like I could go on and on and on about how I am excited and I feel prepared and calm about this third birth. It is just that anticipation and excitement that is definitely getting to me, like I know it does for every mom, and has also for me the last two times. But I would like to end with saying that I've noticed care in the home birth setting has been more individualized, laid back, and I've been more involved and calm in my decisions than I have ever been in the hospital setting, or that I have ever witnessed with a background in labor and delivery nursing and midwifery. The system has standardized guidelines that providers must follow, but we are also in control of our own care, even if that is in the hospital or the birth center or at home. Just because you are giving birth at the hospital, if that's the case, it doesn't mean that you don't have autonomy. You can absolutely have an individualized care experience and have a home-like pregnancy and birth experience, and is something that I love being a part of when supporting expecting families. It's a bit against the status quo, and I'm not saying to refuse all interventions and that the medical model is bad. I just think there is a time and place for everything. Every mom and every pregnancy is different, and I would love to see more engaged and individualized care in the hospital setting specifically. If that isn't the norm where you are, become educated and advocate for yourself, or hire somebody like me to help you through this journey step by step. Thank you so much for tuning into the podcast today about preparing for home birth and how you can mold your hospital experience to have a home-like vibe too, with the right information and prep. I hope you feel more confident about the possibilities of an autonomous birth experience, no matter what setting, and I would love to help you through your journey. You can head over to my website, bethconnors.com, and download any of my free resources, one being a list of essentials for mom and baby with easily accessible links to each product. I include baby items, pregnancy and labor must-haves, and postpartum essentials as well. I also have a page on common items that you probably don't need to waste your money on, and, things to keep your registry and things that you buy for yourself or for baby nice and simple. Enrollment is also open for my online childbirth course, Fearless Birth Academy, that is created for moms wanting an autonomous birth experience rooted in evidence-based information and helping you make the best informed choices for your own birth. Links to all of these resources are in the show notes below, and I hope you find information and support that you are looking for to love your pregnancy and your birth experience. Please reach out with any questions or comments. I would love to hear from you. And then next week, I will be back with another episode. Bye, everyone.